Thank you for joining a webinar looking forward to the proposed 2019 National Survey of Early Care and Education Overview, particularly with a state perspective in mind. Just a few logistics. The phone lines should be muted. If you have a question, you can use the chat feature in the lower right-hand corner to send a message to the presenters, and we should be able to help you out either with technical issues or with questions about the subject we're discussing. We will be recording today's webinar and posting it with slides for your future consultation or in case you'd like to share with others. And we would love to hear from you about any aspect of the NSECE. The number that you've seen so far, the email address you've seen so far, nsec@norc.org, can be your resource for any questions you might have about this study or in follow-up to this webinar. Today, we have two main goals. We would like to talk with you about the proposed 2019 study, the National Survey of Early Care and Education. We've gotten very accustomed to describing it as the NSECE, just rolls off the tongue. Hopefully you will be able to follow along as I say that. So we'll start by talking about the 2012 NSECE and what we learned from that study. And then we'll move on to the 2019 NSECE and talk about what the proposed design is for that study and especially what is relevant for states to understand. And then we'll actually talk about specific opportunities for states to participate in various aspects of the study. I am Rupa Datta. I'm the project director of the National Survey of Early Care and Education. The study is sponsored by the Office of Planning, Research, and Evaluation. Our federal project officers are Ivelisse Martinez-Beck and Ann Rivera. And as I mentioned, I am the project director at NORC at the University of Chicago, and we have a wide range of partners in our work, including Chapin Hall at the University of Chicago and Child Trends. So what did we learn from the 2012 NSECE? Just to remind you of the state of the world, before the 2012 NSECE, it had been 20 years since there had been any nationally representative data on the availability of early care and education. So there were no comprehensive national data, for example, for us to estimate how many home-based providers are there and what types of services do they offer? How many center-based providers are there and what kind of care do they provide? How many people work as teachers, assistants, and aides in centers? And what are the characteristics of our early childhood workforce? And since we know that childcare is very much a locally consumed and provided service, how well does the available supply of early care and education meet the needs of families? And so the 2012 NSECE set out to answer these questions to document the nation's utilization and availability of early care and education and to deepen our understanding of providers and families' experiences. Because low-income families are of special policy interest, many aspects of the study have a special focus on low-income families. If you were on the line when just before we started, we did a little cascade of many of the reports and publications that have come out of the 2012 data since they were released. It's an exciting, very broad set of topical areas and researchers and policy questions that have been addressed. We're just going to stick to some of the basic findings that were highlights of the 2012 findings to date. For example, we learned that there were 129,000 center-based providers serving children age 5 and under, not yet in kindergarten. As I said, prior to the 2012 NSECE, we really didn't know to the nearest 100,000 how many providers there were. So now we know that there were 129,000 in 2012, and that 73% of them received some sorts of public funds, whether those would be child care subsidy dollars, Head Start funding, state or local public pre-K dollars, or something like special ed funds. On the home-based provider side, the NSECE wanted to get as broad a range in 2012 of the different kinds of home-based providers that are providing care to children up to the age of 13 in the country. Because of some statistical issues, we ended up thinking of the world of home-based providers in terms of those who are known to state and national agencies as ECE providers. So depending on the state you're in, that could be licensed care, regulated, registered, license exempt, but known to the agency as an ECE provider. And then we also categorized unlisted providers who are also providing care to young children, but they're not doing that in a way that's known to the state agencies. And so, for example, that could be a business, a family child care provider in a state that doesn't happen to license smaller family child care providers, but it could also be a grandmother who is providing regular non-parental care to her grandchildren for no compensation. So it's quite a broad range. In terms of the listed, which is the group that are known to state and national agencies, we learned that there are 118,000 of these providers. So, you know, similar to the number of center-based providers that I described before, those 118,000 listed providers were serving 750,000 children birth through age 5, not yet in kindergarten. The unlisted care is a very interesting topic that we will unfortunately not be able to talk too much about today given our time constraints. I mentioned that the ECE workforce was of great interest, and you no doubt know that this has been an area of tremendous policy and practice focus in, say, the last 10 years. Our ECE workforce data come from teachers, assistants, and aides who work in centers, and we call them the center-based workforce, as well as the listed home-based providers, so the individuals who are operating those home-based providers that are known to state and local agencies. And for example, we found that high fractions of these workers actually work full-time, so 35 hours a week or more. Almost 3/4 of center-based workers and 85% of home-based providers are working at least 35 hours a week in paid early childhood work. You can also see that the range in the first row on this slide, the range of individuals who have a 4-year college degree or more varies pretty widely. Among individuals who work with infants and toddlers, about 1 in 5 has a college degree, 19%. It's similar for listed home-based providers, where 16% have a 4-year college degree or more. But then when we look at those who are working with preschool-age children, ages 3 through 5, we see that it's almost half, 45% of workers have at least a 4-year degree. I'm just picking, obviously, very few facts along the way, but to give you a sense that there was very little, there were so many things that we didn't know, and so even these very basic descriptions were a huge step forward in our understanding of these very important populations. The other topics that have been discussed using the 2012 data include how accessible are early care and education providers in terms of costs, in terms of location, in terms of the hours that they serve families and children, the range of public funding and the overlap of different kinds of funding sources, provision of comprehensive services such as developmental assessments or access to mental health resources, and then workforce compensation is another huge issue. So now we'll move on to the proposed design for the 2019 NSECE. Let's begin by asking, well, why do we even need a 2019 study? In those 6 years, we've had the first reauthorization of the Child Care and Development Block Grant. After 20 years, we've had revised Head Start performance standards. As you know, there's been an explosive growth in state and locally funded public pre-kindergarten. Many states have expanded their use of quality rating and improvement systems. There was Race to the Top money that was focused on early learning, and then the Early Learning Challenge grants. There are even more, but this list gives us some sense of just how much has changed in the policy landscape that could then manifest itself in changes in what we see in providers and workers and how those resources are available to children and families. So by collecting data in 2019 that will be comparable to the 2012 data, we can answer many of the questions that we answered in 2012, but anew in 2019 in the context of all of these different policy changes that have happened. So that'll be a first step. So what are the availability and characteristics of ECE providers and workers in 2019? Then, because we have the comparable 2012 data, we can also ask, well, how do the 2019 characteristics compare to what we saw in 2012? Has access improved? Do we see different enrollment patterns in the children that are in our providers? There are also a number of questions in the 2012 data that we were not able to answer because of the data that we were able to collect. And we hope that a proposed 2019 study would allow us to answer some new questions. And so, for example, those include, how do providers blend funding from different sources? As I mentioned, we learned that 3/4 of providers' centers are receiving public funding, but that can come from a variety of sources, and that it's very common for a center to have, for example, both child care subsidy money and state pre-kindergarten money. But how are they blending that funding? Is it in separate classrooms? Are the same children benefiting from both? Is some of it going for quality improvement? There are great questions that we can now hope to drill into with the proposed design. We'd also like to better understand which providers are willing and able to participate in the child care subsidy program, and what are the factors that encourage or inhibit their participation in the study. In the subsidy program. And then another question is, how are early childhood providers promoting children's health through physical activity, through nutritional awareness, through things like developmental assessments, for example. So there are some important similarities between the 2012 NSECE as it was conducted and the design that's been proposed for the 2019 study. These will allow us to be able to talk about the change that's taken place in that 7-year period. So both years would have national data that are collected in all 50 states and the District of Columbia. There's a strong place-based aspect to the design, so that home-based providers and center-based providers would be drawn from the same geographic areas throughout the country, so that we can talk about the availability, sort of the supply. When you think about a family living in a particular community, what's the portfolio of providers? What's the mix between home-based and center-based, privately funded, publicly funded? What would that look like from community to community? We will again, we would be talking about a comprehensive portrait of the ECE workforce, including teachers and caregivers in a variety of roles and working in different providing settings, and then a strong focus on low-income areas, both for center-based and home-based care. The 2019 NSECE would be expected to contribute to our understanding of the ECE landscape through a variety of means. First of all, we would have data files that we would make publicly available. And there are 3 component surveys that we're talking about: a center-based provider survey, a home-based provider survey, and a workforce survey. Each of these surveys has a distinct sample and its own questionnaire, and they are designed so that they can be studied individually. So you can just study centers that serve children under 5, not yet in kindergarten, or you can integrate those data with analyses of the workers in those centers, as well as the home-based providers who are offering care in those same communities. And that's true for all 3 sample types and the data that we collect. As I mentioned before, the home-based provider survey provides both data about the provider as an entity, how many children are cared for, what hours are care provided, but then we also recognize that the home-based provider, often she herself, is a member of the workforce. And so we also want to understand her or his characteristics as a member of the workforce: qualifications, hours, benefits, compensation. In addition to the data files, this study will be producing a range of analytic products so that the team, our very large research team, will be producing research findings for a variety of research, practice, and policy communities and audiences, in addition to the work that we hope a broad variety of researchers will conduct. We'll also be providing training and technical assistance to researchers who are using the data. The other thing that we found in 2012 and that we would hope would occur in 2019 as well is that we are able in this project to develop new methods and tools for conducting research on early childhood that other people are able to adopt on a smaller scale in a different setting, and so that we can all, in our evaluation work, in our research and policy work, advance the use of data to improve and inform the ECE work. Let me talk then about the proposed NSECE sample design. And we're describing proposed, many of you may not be familiar with the process. There is a pretty stringent review process that happens with federally funded research to make sure that both dollars are being properly spent, that we are not imposing undue burden on respondents, and that we are adequately protecting the privacy and confidentiality and consent respect that all individuals should be receiving. So to collect nationally representative data, which is our goal, we have to have a master list of whom we are trying to represent. For the NSECE provider surveys, we construct what we call a sample frame of all providers we can find on state or national lists. this work of building the frame has to begin several months in advance of when data collection would start in January. We will be building the sample frame so that we can select home-based providers whom we would then want to interview, center-based providers whom we would then want to interview, and then the center-based workers would actually not come directly from our master list, but rather they would come from the centers whom we interview. So let me talk a little bit more about this sample frame construction process. We will be trying to construct a comprehensive compilation of all the available provider lists we can find. So those would include a list that includes national level lists, such as the Federal Office of Head Start, General Services Administration, Departments of Defense, NAEYC, and other private organizations have lists of providers. So there are national level data. There are state level lists, as many of you know, of regulated and listed child care providers. For example, lists of licensed home-based providers, centers, potentially before and after school providers, public pre-kindergarten programs, perhaps providers who receive CCDF payments. So there are a variety of lists at the state level from child care licensing and subsidy agencies. That's one of the biggest sources of lists. Then we will also have state level lists of public pre-kindergarten. There are publicly available lists of public pre-K programs from large school districts. And then we also will look at commercially available lists of elementary schools where they may also be providing care. So we take all of these lists, we will deduplicate the records by address. Often there's missing information, for example, exact addresses or what exactly is the licensing status. We will connect these addresses to the communities where they are located and try to understand which, for example, are in low-income communities versus higher-income communities. And then, as I mentioned, we'll be looking at elementary schools because we know that that is the main place that early care and education may be provided that is not on one of these lists already. School districts can provide services to children, early care and education services to children that don't have to be on, say, a child care licensing list. And so we will actually call elementary schools to find out whether or not there is an early care and education program in that. So I'm going to turn to what will actually be happening in individual states, but I see that we have a couple of questions. Brian, could you read those questions?
Sure thing. So we have a couple of them here. So will you be able to link 2012 files to 2019 files, follow providers longitudinally?
Great, that's a good question. Our expectation is that we will be able to follow communities longitudinally so that we would be able to generate estimates about how a place has experienced change. It's not likely that a lot of providers would be selected in both time periods, and we know there's a lot of change in providers from year to year, so the best nationally representative estimates will not actually include a lot of providers who are in both time periods.
Okay, we have a couple other questions if that's okay.
Yeah.
Somebody asked me, is there any ability to influence the questions that will be asked? Would be great to have data on benefits in addition to just salaries.
Yes, so we would welcome any input to the questionnaire content. Again, the nsece@norc.org email. We have been soliciting input, and the OMB clearance process I mentioned also solicits input into questionnaire content. We do have benefits questions, since you mentioned them specifically. There are a variety of benefits questions that are asked in addition to professional development related benefits, that the questions differ a little bit from questionnaire to questionnaire, but we would welcome input. And I should also point out that the 2012 questionnaires are available on the OPRE website, and wherever possible, we are trying to retain very similar questions. So that would be a good place to start if you're interested in certain topics. Is there one more question, Brad?
There are a couple more questions. That's okay. Next question that was sent to me was, will you be gathering data regarding generational diversity in the EC workforce?
Certainly, we are. Age is one of the variables that we collect, and we have noticed that there are differences in qualifications and the types of centers that people work in by provider age in both the centers and the home-based, and that would, I expect, be an area of research that people would want to conduct with these data. Okay,
a couple more. How can we help the team gain access to complete listings, especially those providers exempt from licensing who are not available via the CCR&R? Our state has a large number of license-exempt kith and kin providers serving subsidized children.
Well, that is just my dream question ever. But let me return to that one, because the slide that we're looking at will actually focus more on that.
Okay. Then I believe we are... Oh, one last question. Will the sample be large enough to do state-level analyses, or maybe by region?
For sure by region, and if I make it to the second half of our slide deck today, we'll be talking more at length about the types of state-specific analyses that can be done, and how to get a sense of what would be possible in a different state and what you might be able to do about it. So great. Thank you for those excellent questions. And you can keep them coming, and we'll pause again later to tackle the next set. So I'll turn now to this question of what are the NSECE activities that would be happening in my state. So every state and the District of Columbia will be host to NSECE data collection activities. There will be providers and workers sampled in every single one of those 51 places. In addition, schools may be sampled, and in that case, we would be contacting school districts for permission to talk to those schools. And then in many cases, we would be asking for endorsement letters or key stakeholders. I think there are many stakeholders on the phone today. We find it very valuable for trusted members of the community to endorse the study and encourage their community members who are sampled to participate. We can't share the names of the people who are sampled or the organizations who are sampled because we have to protect their identities, but we are able to find ways to ask for letters, newsletter mentions, logos, things like that, that treasured, valued stakeholders can use to help encourage participation in their area. Let me go back to the first bullet here. The first thing that a state would perceive would be our list gathering activities, which have begun. And what we've begun with is the accessing of publicly available data. So we have been looking at every state's childcare-related websites for searching for providers. Many of you, as you know, have downloadable lists or nice maps where we can search for providers. We've been downloading files. We've been scraping websites to get that information. We will then be contacting state agencies to make sure that the data that we have collected is the most up-to-date. We will review the information that we have, and if we notice anything about the state in 2012, many states were able to provide us with with lists of license-exempt providers or providers who were receiving child care subsidies, in addition to the more routine licensing and registration lists. And so that will be very valuable. We also know that in many states, you may have a contractor or other affiliated organization or partner who actually maintains the lists, and we would be asking on a state-by-state basis, if needed, for your assistance so that that partner organization could help us gather lists. This collection of as many complete lists as possible is really critical to the quality of the data, and we will be working state by state on an individual basis to collect that data with as little burden on the state as possible. I think this comes back to the other question that people asked, somebody asked about. So what might be the value of the proposed 2019 NSECE for states? We do have data, we would have data from all 51 states, and so at a minimum, these data allow us to learn about how providers and workforce members in one state compare to similar states or to the rest of the nation. I do a lot of work with state administrators in human services areas, and we often hear the question, well, I just wish I knew how it worked in other states. And the beauty of national data are that they can allow that kind of uniform, comparable data across states to support some of that questioning. Again, the study would provide data to support reporting about program availability. Some of the specific policy areas that the data should be relevant to would include subsidy eligibility rules, health and safety requirements for child care providers, professional development systems, how quality improvement efforts are being implemented, particularly on the workforce side. And then the final area is kind of, well, what can I know about my state alone? And this is a trickier question because you may have noticed that our 50 states in the District of Columbia vary tremendously in many characteristics, including size. The laws of statistical sampling design mean that we really draw samples in each state approximately proportional to how many people there are in the state, how many children there are in the state. That's not a perfect description of the statistical approach, but certainly large states have more NSECE sample, and small states would have fewer NSECE sample. What that means is that what analyses are possible vary dramatically depending on the size of the state's population. I'm going to try to give you some sense of how that variation works. With the 2012 data, so we know it works because they've already demonstrated it, is that we've seen comparisons across states of, say, workforce characteristics or the availability of public pre-kindergarten. We've also seen researchers use variation in state policies, for example, for subsidy receipt, to say, look, in states that have this kind of wait list or this kind of reimbursement rate, this is what we see happen in family search behavior or what center quality looks like. And so you could find your own state in those types of subsidy profiles to understand what the data would say for a state like yours. And then in selected cases, people have conducted single state analyses of workforce needs, of households' geographic access to subsidized care. It's perhaps only mildly a coincidence that Illinois, where NORC and our partner Chip and Hall are located, is one of the states that has been able to do Illinois-only analyses of NSECE data. So you no doubt would like to know what is possible for your state, and unfortunately the answer is always, well, it depends. But this slide tries to give you an idea of how this would work. What we've done here is organized all 51 states, including DC, into 3 categories: the purple column on the left, the orange column in the middle, and the green column on the right. I'm going to start with the right-hand side. So we're focused on how many center-based providers serving children 0 to 5, not yet in kindergarten, are located, are available in the NSECE data from 2012. The green column on the right shows states with 100 or more center-based providers. This is a fairly large number of cases, which means that various analyses of ECE providers and the ECE workforce are possible for those states. There's some variation across these states, of course, but it is possible to generate state-specific estimates for these states. So you could say what is the proportion of center-based providers who receive public pre-K funding in California. That is an answer. That is a question that you can answer for the states in the green column to the far right. Then the orange column in the middle shows states with somewhat smaller numbers of interviews. For these states, there is a much more limited set of analyses that are possible, mostly taking the entire state and comparing it to other states or national numbers. So, for example, it might be possible to describe the average hours worked by all center-based workers in Connecticut, but not to separate that out by those who are working with infants and toddlers versus preschool children, things like that. And then the far left is actually the list of states that have the smallest number of interviews. In this case, we're talking about center-based providers. And so these are 50 or fewer center-based providers in our data file from 2012. The number of interviews in the 2012 data basically prevents any state-specific analyses in these states, meaning we could not say Delaware has centers that do X. And that's because of statistical reasons, meaning the validity of the data, as well as privacy protections that we have in place to limit what people can say about the data publicly so that we can make sure that our respondents' privacy is protected. The 2012 NSECE public data sets can be downloaded by anyone on the internet, and those data do not include identification of states. We wouldn't expect 2019 data files to include that either. However, we have a variety of mechanisms in place so that researchers can access geographic identifiers under controlled conditions, and we have, I think, close to 100 researchers who are doing that at this time with the 2012 data. In the interest of time, I'm not showing the similar tables for home-based providers and center-based workers. I will say that in general, fewer states have large samples for home-based providers. Then for center-based providers, so if you look at these columns, being on the right-hand side means you can do more analyses, and being doing on the left-hand side means you can do fewer analyses. For the home-based providers, everyone kind of moves to the left. And then for center-based workers, the table looks very similar to what you see here for center-based providers. So as I just described, the national study is designed and would be executed in ways that are relevant to states in a variety of ways, but there's no guarantee that the sample in a given state would align well with that state's priorities. And so one of the things that the study includes is a feature where OPRE allows states to supplement some of the national study activities with state or local funds. So as you can imagine, this study has a lot of data collection operations, sampling expertise, analytic tools that are not readily available to many states. And so we've tried to identify a few ways that might be particularly valuable for states who would be interested in taking advantage of the NSECE enterprise for their own priorities. One of these is to commission additional interviews to be conducted in your state. So the national study, based on the rules of statistics, would have a certain number of cases allocated in each state, but you could choose to add funds for additional sample to be collected in the state. A second option is related to that sampling frame construction process I described earlier. We will be building this frame. It's rich, geographically detailed data that connects population features, like from census data, with geographic information, with provider lists. You might even, if you had inspection data or QRIS data, want to enrich those data in a variety of ways. And we could, as part of our process, help your state build that kind of enriched statewide list of providers, even if we didn't do any additional data collection with that. So that would be more like a research tool that we would provide you that would take advantage of our list gathering, compiling, geocoding, and other analytic capabilities. And then the third option would be to support linkages to state administrative data. So you all may have subsidy data, you may have other private information that you have in your administrative data files that could be linked to the survey data for analytic purposes. And so that would be a third option, is to commission some linkages. So if you were interested in the data collection option, there's so many variables that there's really not a one-size-fits-all process. We would encourage you to write us, again, at nscc@norc.org. And if you can describe what you would be interested in, for example, are there populations of interest, such as low-income low-income areas or rural areas? What group, what are the types of questions that you're interested in? Then the NSECE team can help spell out what would be possible within the NSECE design and give you some cost estimates for what would be involved there. We did have 2 states in 2012 that took up this option. If a state did supplement the data, then those data preparation, data collection activities would all happen in conjunction with the main study, and those data would become part of the NSECE data files. But it is possible, especially I think for states in that middle column of the tables that I was showing, the orange one, to move themselves to the far right to expand the available feasible set of analyses if they wish. We'd be happy to talk to you about that. I mentioned we could do a sample frame supplement for you. This would be helping the state to achieve a more full-featured list of all of the providers and some understanding of how they connect geographically and with population characteristics. The screening of elementary schools, which I mentioned, is a step that's often not feasible for local researchers, and that would be part of what we would do. We found, in most states, double-digit percentages of providers are located in school districts and not on any of the existing lists. And then the third category I mentioned was commissioning analyses that link the state's private data, for example, on subsidies, either provider subsidies or families, either subsidy files about providers or subsidy files about families, to the NSECE data to answer questions of interest. The analysis opportunity has kind of its own timeline because that would happen once data are available. But if you were interested either in supplementing the data collection or in this sampling frame option, then we would need to be talking with you fairly soon so that by the end of August, we'd have commitments about which states were going to supplement project activities in a variety of ways. Data collection would be expected January through May of 2019, and the first data files should be available in September of 2020, with analyses beginning in 2021 and, of course, hopefully continuing for many years. I'll note that the 2012 NSECE included a household sample of interviews with parents of children under age 13, as well as this unlisted home-based provider population, who are the individuals who are not known to state and national agencies but are providing regular care to children under age 13. OPRE is currently considering the addition of a household sample to the proposed 2019 NSECE. So that work is still uncertain. Household interviews would collect information on families' use of ECE, including schedules, costs, and preferences. And then the unlisted home-based providers would allow us to complete the full range of providers that are serving young children. Okay, the two easiest places to find a ton of information about the NSECE are the ACF website, the Administration for Children and Families website, which has a page for the national survey, as well as Research Connections, which many of you are familiar with, that includes a page devoted to the NSECE, and that includes the data, the questionnaires, many of the analytic findings, and other resources as well. So I think that we have come to the end of our planned remarks. I'm going to leave this slide up so that you can get that email address in case you haven't heard me say it enough times today. And Brian, I think we have time for one or two more questions.
Okie dokie. I'll read them in the order I received them. So the first question was, will the study look at availability compared to the young child population by locale and or equity in access, enrollment, quality as a function of child SES or ethnicity?
We certainly hope that all of those things will happen. I would say that the design of both the 2012 and the 2019 NSECE is exactly focused on that set of questions, and I know that there are a variety of researchers who are working on the answers. As you might imagine, it's a complex question, so I expect work will be continuing for many years using these data. But low-income families, access, availability, as I mentioned, hours, funding, cost, slots, the relationship of the providers to the local community are all key aspects that we try to collect in these data.
Okay. A couple people asked this question in some form. What is the timeline for submitting ideas for additional questions to incorporate into the next survey?
We would like to hear from folks as soon as possible. Draft instruments have been submitted for this OMB process, and so the questionnaire process is well on its way, but I would encourage as soon as possible, but I'd also say that a lot of the questions that we received in 2012, we fortunately had the data, so it was really a question of how the data should be analyzed. So I would welcome input at any point, but the sooner it comes in, the more likely it would be to inform the questionnaires.
Okay, if there's a little more time, will tribal childcare be included in the study? Many are only tribally licensed.
Yes, for sure. We do gather lists and we cover the entire country, and so we do include tribal providers in the data. Unfortunately, the sample sizes are often small because they're spread out throughout the country and of very different types, and so it doesn't necessarily make sense to lump them all together. So I would say that analyses of tribal supply specifically are quite hard to do, but certainly providers in tribal areas are part of the sample and do contribute to the data, and we would welcome assistance gathering those lists and making sure that we have as complete coverage of those lists as possible within our work, as well as assistance getting permission to interview on tribal areas, which is a big challenge for us. And so we know that having a local sponsor or champion who can help us gain permission in tribal areas is also very valuable, and we would love to hear from anyone who is willing to help us out with that.
Okay, one last one. Curious to know if community foundations and/or other funders have used this report for strategy development.
That is a great question. I know that a number of the publications that we cite were sponsored by foundations, and that much of the practice work, for example, in workforce development and QRIS expansion, cites NSECE statistics. So we hope so. We don't always hear exactly what information people use to make their decisions, but we know that they're aware of the study and they're citing the evidence in their work. So, and we welcome more about it at all points. Okay, we have come to the end of our hour. We appreciate everyone who has joined, and we welcome any follow-up questions that you might have. If you want to, we will follow up with an announcement for where the webinar is posted in about a week when it's available. Okay, thank you very much for joining today.